Welcome to Health Matters Plus. Right now, we are at pediatric facial therapy. We want to understand kids, facial therapy, kids vegan. What conditions are we trying to manage here? And I'm joined by a specialist in this profession. She's going to explain to us. First of all, welcome.
Thank you.
This is the second time we are having you, of course.
Yeah.
Introduce yourself.
My name is Miss Orin. No. My name is Miss Kende Gichunge, and I love pediatrics. So I'm a specialist in that sector. Yes.
All right. Here at pediatrics, physiotherapist. What conditions are we trying to manage here?
Okay. So for pediatric physiotherapy, we normally deal with some of these conditions that affect children.
Okay.
Yes. Some of the conditions are congenital, meaning that the child was born with them, and others, as the kid grows, they might get to suffer from these conditions. So, for example, we have the cerebral palsy, which is a congenital, and sometimes after birth, a child might end up getting the cerebral palsy. We also have the Down syndrome.
Can we do like what is cerebral palsy?
So for cerebral palsy, it's a condition that a kid gets after maybe during birth when they fail to get enough oxygen in the brain. So there is a brain dead in the brain. Or maybe later in life, this child gets to experience maybe a certain condition which causes them to get the cerebral palsy. It means that the cerebrum in the brain lacks oxygen. So there's some death.
What other condition?
We also have the hydrocephalus.
Hydrocephalus. What is hydrocephalus?
This is where a child's there is this fluid in the brain called the CSF. It's normally supposed to drain, but now in this case, the fluid is not draining, so there is a build-up of this CSF in the brain. So they normally go through a procedure to get a shunt to drain the fluid, but because of the fact that the head had gotten so big due to the build-up, they normally have they lack neck control. So we normally have to do some physiotherapy to help the kid regain the strength in the neck to hold up the head.
All right.
Yes.
What other conditions do we deal with?
Other than that, we have delayed milestones.
What is that?
Delayed milestones, delays. So there is mtoto amekosa kuachieve a certain thing yenye anafaa kuwa ameachieve at a certain age. For example, when you give birth to a baby, at some point they have to gain some neck control, and at some point they need to start crawling and sitting, standing, walking. So this child at this point amefikisha ile umri ya kuwa ameachieve hizi vitu but hajaachieve. Yes, that's
right. What other condition?
We also have meningitis. So this meningitis, it's inflammation in the meninges of the brain, which affects children sometimes later in age as they develop. And after getting this meningitis, some kids might end up having delayed milestones because they are not going to develop normally, especially after the conditions. The child might suffer meningitis for some time, which is going to cause a delay in the growth of this baby. So we also handle that. Yes.
So let's say my child has been diagnosed with these conditions and I'm bringing them for physiotherapy. What activities are you going to help them regain normalcy or close to normalcy of their life when I bring them here? What kind of activities help in achieving normalcy?
So for the activities, depending on the defect or the deficit the child is presenting with, we do different exercises. As you can see here, we have such a thing. This is called a Swiss ball or a therapy ball.
What does it do?
So we use
who use it is because you've said they are tailored to specificity.
Yes, so you might meet that this child is not able to sit
Okay.
na ashafikisha ile umri ya kuketi.
Okay.
So it means that these abdominal, the core muscles,
Okay.
which are supposed to help you do the sitting,
Okay.
are so weak.
Okay.
So we use this to try and strengthen your core muscles,
Okay.
among other things such as we have the Vera bands, which we normally use for strengthening.
Okay.
We have the manual techniques such as stretching if the baby has so much stiffness
Okay.
in let's say the legs or
Mhm.
even the upper limbs.
Okay.
So we do strengthening exercises,
Mhm.
we do stretches,
Okay.
we do soft tissue manipulation to
Okay.
help in reducing tension in the muscles.
Okay.
We also have a heat therapy.
Heat therapy.
Yes,
Okay.
which helps the baby in at least increasing the circulation in the body and some relaxation.
Alright.
Yeah, because sometimes the sessions might be so intense,
Okay.
and the muscles might ache.
Okay.
Yeah, so it helps in relaxation after that.
Okay.
Yes.
So how long, let's say, see, this is a child, right?
Mhm.
How long will they undergo this physiotherapy? Ama is for life, how does it happen?
Now, depending on the severity
Okay.
of the condition,
Okay.
plus, people heal differently.
Okay.
There are those people who might heal a little bit faster compared to others.
Alright.
I cannot give you a specific time span. So
Alright.
it depends on how your baby is going to respond
Okay.
to therapy. Yes.
What is that one myth and misconception you have heard about pediatrics physiotherapy, and you know that is totally untrue?
Watu sema amerogwa. Mjarogwa.
Hawajarogwa.
Yeah, amjarogwa. And I know it's a little bit difficult
Okay.
once as a mother you realize that a child has any of these conditions.
Okay.
These parents, ukiona jirani yako or someone you know has a kid with such an issue, give some support.
Okay. As the parent brings the child, and you also give them moral support, am I just focus on the child?
You definitely have to. The parent or the caregiver, the primary caregiver who comes with the baby, we try to involve them in the session because we will give you some home-based programs for you to do with the baby at home. And we have the programs we need to do here. Yes, so we normally try to involve you as a parent to make sure you are involved in the therapy of this child.
Okay.
Yes.
So at home, what activities do you give them at home to do?
Let's say we might even give you, depending on the condition that is, we might ask you to even do some standing with the baby, to do some playing with the baby.
Okay.
Yeah, it helps so that the baby also feels loved.
Okay.
Yes.
All right. Let's go to we still go to hydrotherapy and autism.
Yes. So other than using the
Other than
room that
using-
we are in here,
Okay.
we have another type of therapy we call hydrotherapy.
What is this hydrotherapy?
So from hydro, it's water. So it's water therapy.
Okay.
So this is where we have a heated pool, which we normally use for hydrotherapy.
Okay.
It has a jet which produces water at a high pressure.
Okay.
So this hydrotherapy helps mostly. You do the exercises in water. The water is warm, so there is relaxation.
Okay.
Even if the baby was so stiff, the muscles get relaxed.
Yeah.
And the baby gets comfortable in the water. So it's easy for you to do the exercises without forcing this baby to do them.
Okay.
Yeah, it's like you're playing, the baby is enjoying themselves, and you're also doing therapy at the same time. So it's so effective.
Okay.
Yes.
Which conditions are we managing with hydrotherapy?
So for pediatrics, we also take autistic kids.
Okay.
It helps in calming them down, reducing the energy levels, trying to make them interact.
Okay.
Yes.
The hyper kids, eh?
Yes, hyper, all of them, so long as in the atypical.
What is Down syndrome?
So another condition that's called Down syndrome.
Okay.
So for Down syndrome, it's where a baby is born with an extra chromosome.
Okay.
And they normally present in a certain type of way, different than the normal kids or than the normal presentation that you and I have.
How do you identify that my child has Down syndrome?
their features, their physical features, the facial features,
Okay.
you might meet that the ear is slightly smaller, but it's located slightly lower than where it's supposed to be. Slightly, the eyes are slightly lower too, or the nose is slightly smaller. Yeah, so it's easy to identify a person who has Down syndrome.
Okay, so when I have identified that, the doctor has identified that my child has Down syndrome, and he recommends for physiotherapy. So when I bring the kid here, what should I expect as a parent?
We'll try to help this child be able to do the activities of daily living without support.
Okay.
Yes. So if it's strengthening, we try to help you get some strength for you to maybe walk without support. Yeah, and do all those activities without support.
Brilliant. Thank you very much. If you have a child who is suffering from some of these conditions, you can bring them here at Villa Fishes on Karen, and they are going to help manage your kid to be able to perform some of these activities. Do you want to hear here? Yes, and also we're going to give you some moral support as a parent. So you're welcome at Villa Fishes. They're going to find Dr. here, and he's going to help your child in these conditions. Thank you very much.
Okay.
Hata mbona hata